Welcome to Thoughtful Planning, the place where real conversation, expert insight, and a touch of humor meet to turn our end-of-life uncertainties into self-assurance. I'm your co-host Santiago, a history buff and a big kid at heart.
And I'm Honey, your guide through the intricate dance of planning with care and a whole lot of warmth. Every week, we're here to turn those intimidating "are we ready" moments into confident everything is under control moments. Today's journey is one you won't want to miss.
Hi, I'm Santiago, your host today for a very special episode about the fight. So first, a content warning. This episode contains discussions about cancer, its treatment, and the side effects, which for some may be emotionally challenging. In this episode of Thoughtful Planning, I will share my personal experience during my battle with throat cancer. Through my journey, I highlight the challenges of everyday life of a cancer patient, the importance of planning ahead, and hopefully provide some practical tips to help others navigate similar situations. Honey's already done her episode about caretaking, and she left a couple things out that I'll fill in the blanks. Just because of what I saw from where I was sitting as a cancer patient. So first, like we always do, let's talk about our essential question. And it's really the same thing that Honey asked you in our last episode. Why is it important to plan for emergencies or end-of-life situations while you're clear of mind? And I can tell you, when I was battling cancer, I was not clear of mind. So let's talk about a little bit about what my life was like before I was diagnosed with cancer. I felt relatively healthy. I had my aches and pains that come with, 21 years plus of military service. Back aches, knee aches, this ache, that ache, all those aches that come with that. I was a JROTC instructor / coach. So I was pretty active with the kids, getting in at 6 a.m, leading them through PT, not always doing PT because of how I felt sometimes in the morning. And in 2015, Honey and I ran / walked the Marine Corps Marathon. And that was back in October. It was the 25th of October, to be exact, of 2015. So my cancer journey for me really starts on the military move, our final move. As we were driving up somewhere on the road, I kept coughing and I felt something, right here in the back of my throat. Didn't quite know what it was, but, I kind of felt like I wanted to reach down and scratch whatever was in there out. Honey was like, drink water, you know what, you just have to go to the doctor when you get back, and I agreed. So in early July, when we completed our move, I went to see my primary doctor. He looked at my throat and he said, I need you to go to the ER and get this checked out. I was like, what's wrong? He says, I'm not sure. Haven't seen anything like this, which I think he was not 100% truthful with me. But he wanted me to go to the ER, which I did. I called Honey, said, hey, I got to go to the ER. They want me to get checked out. And she's like, keep me informed, that kind of deal. So in the ER, they're at Brooke Army Medical Center, or SAMC as some call it, San Antonio Medical Center. It's the premier medical facility in the military service. It's where the doctors and nurses and all the specialists go to get trained. So it's a learning hospital for the military. I went into the ER. The doctors looked at my throat and they told me, stand by, we'll be right back. Well, in comes a specialist from the ear, nose, and throat clinic. He took a look and he said, you know what, sir? Come on up. We're not going to occupy a bed down here. Let's go up to the clinic and we'll get you checked out. So I followed him. They checked me out of the ER. We went upstairs. And they looked at me, poked and prodded in my throat. and they said, we're gonna do a very non-invasive test real quick before we schedule you for a biopsy. So they took this long needle. In my mind, it was like this big, and they put it in my throat and were poking and prodding. And non-invasive, well, they lied. It was pretty invasive. They stuck the needle into what now I know was my cancer, and extracted a couple cells so they could do a quick biopsy. A couple weeks later, as our household goods were being delivered, I remember the truck pulling up and me telling honey, I got to go. And she's like, yeah, I know. You got to go to your pre-op. And this was the first time in my entire military career that she had to unpack alone without me. And everything went smooth back here. They loaded most of the boxes upstairs in our new home. And I went to the appointment. Wasn't a big deal. And then a couple of days later, I was actually, getting my biopsy done. A couple weeks after that, I went back to the clinic for the diagnosis. And I remember, because it was the 25th of July, 9 months after the marathon, but more importantly, it is St. James Day, Dia de Santiago, the date my grandfather was born. I'm, of course, the third, and it's just an important day in my life and my family's life. And that's when I was diagnosed with stage 4 cancer in my throat. Honey went with me, but I went in alone to talk to the doctors first. They gave me the diagnosis. I lost it a little bit. It was like, I can't believe this, blah, 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 all that good stuff. I regained my composure, went out and got honey, brought her in, and then the doctors gave her the diagnosis. And, of course, she was a bit emotional. We were both a bit emotional. Had a lot of questions, gave us some answers. But they told us that we needed to start treatment as soon as possible. And for both of us, it was just disbelief. I remember going to my mom, letting her know what was going on, getting both of our children on the phone at the same time so we could tell them what was going on. Of course, Shelby is in California, and Santiago was here with us in San Antonio. So that was a hard day. But a couple days later, we started the treatment. So first came the surgeries. I had to put a port right above my collarbone, or right underneath my collarbone, I should say, right here. And then they took the line and they wrapped it around my collarbone so I could actually feel the little line. And the chemo port went directly into the artery that fed my heart. The reason they did that into the heart itself is so when the chemo would go in, it would pump into the heart along with the blood, and then get dispersed throughout the body right there, then and there. The best way I can describe it, it was a little steel plate with a ball on the front, half a ball, and then that's where they would poke me when they were putting in any medicine, to IVs. Everything went in the port. The skin around there actually got numb. For a while, they were, putting some painkiller on it, some local, but after a while, I didn't even need it. It was just like, okay, go ahead and poke me. I'm ready. And then I thought that I'd be strong enough to eat and get through the cancer and all that stuff, the treatment, really, the radiation. But I decided to get a feeding tube, a peg tube, put into it's on the left side of my abdomen. I call it my second belly button. So was really weird. It was a hole directly into my stomach, and there was a couple of buttons that they actually put there. They looked like buttons that tied and held my stomach to my abdomen wall, and then they cut a small, probably about 1/4 inch diameter hole into my abdomen wall and into my stomach, and that's where the tube was. And it had a little cover on it, and it was taped to my belly, all that good stuff. We just had to keep it clean. That was a daily thing that we had to do, is make sure that it was good to go and didn't get infected. Then once that was in, the stomach tube was in, I had to go get my radiation mask fitted. And it is kind of, I don't know, barbaric in a way, because what they do is they put this moldable plastic on your face, and it covers your face and your neck. And the reason they do that is they attach it to a metal frame that actually gets bolted to the bed. So when you go in, they put the mask on you, they bolt your head to the frame so it holds you perfectly still. So when the radiation machine goes around you, and it starts in the lower body and in our lower side, left-hand side as I recall, and then it would go all the way around your head, shooting radiation. For me, it was right here. And it would hit it from different angles just going in. So this thing would go around. It would last, the total appointment in radiation lasts about 15 minutes. So the first time they put the mask, after they molded it to my head and strapped me to a simulator to simulate the radiation, to make sure they had marked it right, and they put little red lines on the mask to make sure they were hitting it. They hadn't given me eye holes. So they strapped me down, put the mask on my head, my eyes were closed, and I could hear all this noise. And that was the first time that I felt claustrophobic. I started freaking out, and I was like kicking, and I'm like, get me out of this thing. And so they did, is they took the mask off, then they cut holes around where my eyes were, and I could see I was good. So they ran the test again, make sure we were good. And that's when, once all that was done, that's when the radiation started. So my throat, when we went through the radiation, one of the side effects was it kind of felt like a sunburn in my throat. So, you get the little red sunburn here. Well, imagine it being like 10 times worse and in your throat. It was very hard to eat and drink. So that was some things that we went through with radiation. And of course, we went Monday through Friday. And any holiday, we didn't have to go in, because, cancer doesn't grow on holidays or the weekends. But every weekday we went in. It was a little over 7 weeks that we actually did that. Then they told me I needed 3 rounds of chemo. I was given a chemo that was platinum-based called cisplatin, and it was very hard on my body. Some of the side effects, nausea, vomiting, hearing loss, nerve damage, check. Yeah, I had all that stuff. So the challenges we had to go through, the first thing was the radiation, like I said, the sunburn in my throat. I started eating soft food, soups, drinking a lot of water, and actually drinking a drink that they had given me for, a nutrient drink. And I didn't like the first couple ones. I mean, when I didn't like it, my body didn't like it, and I would throw it up. So then they gave me my first round of chemo, and it was pretty early in the process. So that chemo made me sick. Then I rejected all of the protein drinks that they were giving me. I just got super, super sick. I went from 185 pounds down to 134 in a couple weeks. So I wasn't a big guy, but I'm 6 foot, so 185. I was in good shape, but at 134, I was a walking skeleton. I remember getting sick, and when we went to see the nutritionist, she was like, "Oh, you just don't like the taste, that's why." And I got sick in her office and started throwing up stuff and just throwing up water. So finally, she figured out, the doc figured out what I could drink, and it worked. I didn't gain a lot of weight, but I didn't lose any more when I dropped down to 134. They used the feeding tube, and they gave us a kangaroo, Joey. It's a feeding pump, and it worked pretty well once we figured it out. And Honey told you our handoff at the gas station already, which we thought was kind of odd, but it was a blessing once we got the feeding tube working. I mean, the pump working through the feeding tube, because I don't think I would have made it without it. Then there was a nerve damage. I developed what they call drop foot, and so drop foot is when you can't walk. It was my right leg, and I would like pick it up a little bit, and I would drag it, and then I couldn't feel the ground. It would just flop. So I would like limping, and it was kind of hard, having, again, 9 months before, finished a marathon, and now I could barely walk. So I was walking with a cane, and whenever I went upstairs, Honey was behind me. She would always make sure I wouldn't fall, which unfortunately I did a couple times, but I never really hurt myself when I fell. I was constantly dropping things. And the reason I was dropping things is because of the nerve damage from the cisplatin. So what cisplatin does is it actually kills small cells. So all the small cells in my fingertips and in my hands, and then in the nerve running down the side of my leg to my toes. For some reason, it affected mostly my right side. My left side was a little bit stronger, but I would still drop things. I broke so many glasses, both plastic and glass, that we ended up buying a bunch of steel mugs with tops on them that I could close, and if I dropped it, it would go ding, ding, ding. That's about it. It wouldn't damage it. I just finally got rid of most of those because I kept them for some reason. I don't know why, but I finally got rid of them because they were just a bad memory sitting in the kitchen. Really, it was really tough to get around. Luckily, I didn't need Honey to go to the bathroom. I could take care of all that myself. I would have really felt bad if she would have had to help me in there. Even though when I did go to the bathroom, I had to take my feeding pump and my IV stuff when I was really sick at home and have it right outside while I was going to the bathroom. And that gets to balancing work and home life. For the first week or so, I went to work every day. I had a great boss that when I got so sick I couldn't go into work, he let me take my leave. And I had a little bit of leave to burn. I didn't take much leave while I was working. I didn't take much leave in the military. But I would always go in. Being that we were going in every day, about once a week I would stop by. Honey would pull me the backside of the building where I worked, help me up the stairs, and I'd go in, and whatever class was there, I'd walk in to say, "Hey, what's going on?" I wanted the kids to see me and to see that I was fighting and they didn't have to worry about me. And that was important for me, just to go up and let people know I was still doing okay. There were things I couldn't do around the house. When we normally moved, I would have all the boxes cleared, stuff hung on the wall, boxes laid out by the curbside within a week. I didn't like the clutter. But this time I couldn't do that. And neither could Honey, because she was caring for me. And so for the first year in my house, I did not come upstairs. Luckily, our main bedroom is downstairs, and we have a walk-in shower downstairs, so I didn't ever have to come upstairs. And it was hard for me as the man of the house, as a guy that did everything outside, mowing the grass, trimming the bushes, working to make sure the trees are trimmed. It was hard not to do that. And just the psychological part of that, not being able to take care of myself, having honey watch me while I was taking a shower so I wouldn't fall, helping me clean everything and replacing bandages. It was kind of demeaning, I guess. And I know it was hard for her. Later, she told me that she would, take a shower early in the morning before we'd go to BAMC for treatment, and she would cry. And there were times that she would tell me she'd cry on the drive, and I'd be sleeping because I was so tired and so worn out. And that in itself hurt a lot, to know that I put my wife through that. So the hospital that we went to was BAMC. And again, BAMC is the premier hospital in the military. I had 3 doctors that I went to. First doc was in the ENT, the ear, nose, and throat clinic, Dr. Newberry. I have nothing but great things to say about Doc Newberry, and he is the utmost professional. He, with the exception of him being an Air Force officer, there's nothing I could complain about. But he was my doctor there for 8 years. He just recently announced his retirement and be retiring here in November. And I'm sad to see him go. But, I met him as a major. He's retiring as a lieutenant colonel, and he's going to go work in the civilian side and help a lot of other people. I'm just thankful that he was my doc, and that I got to meet him and know him as a person, because he's freaking phenomenal. I had 2 radiation oncologists that I saw. My favorite of the 2 was another major, Dr. Wong. And Dr. Wong is my kind of officer. Well, besides her being another Air Force person, but she is a no BS, non-sugar coating doctor who was the utmost professional. She would pat me on the back when everything was going right, and she would get so mad at me when she found out I wasn't eating right and I wasn't following directions. She stayed on me to make sure I did what I was supposed to do. And I really appreciated her for doing that. She's super strong, and I like that in a person. Now let's talk about the hemo-oncologists. So the blood docs, they're the ones that are actually, giving me my daily IVs when I needed them, and putting the cisplatin into me. So the first one was a train wreck. The first time I met him, he read me another patient's file. And, we go in there and he's like talking about the cancer being in my nasal cavity and it's inoperable and this and that and no chance of survival. And Honey and I are like, yeah, that's not right. It's in my throat. No, it's in your nasal cavity. What's the name on the file you're reading there, Junior? And he looked at it and he became flush and he's like, I got the wrong file up. And I said, okay, young man, another major and an Army major. I told him, get your boss. You're not my doctor. Well, that's not how it works, sir. I said, go get your boss. You're not my doctor anymore. So he brought in another major, Air Force dude. I don't know what was going on with the Air Force people, but they did all right to me. He said, "Sir, this isn't how it works." And I told him, either he's gone and I get another doctor, or I walk out of here, go straight to the CG's office and explain what just happened in here. They walked out. His boss came back and said, "Surprise, I'm your new doctor," basically. So he did a good job with me. He got me through my routine, going in there for the 3 times for chemo, giving me my daily IVs that I needed because I wasn't getting enough water and nutrition that way, so they'd help me out with the IVs. The only thing that I really had a complaint with the last guy was he called me the day my daughter graduated from North Dakota State University, and to tell me that, hey, the cancer's still there, we're going to have to go in and cut everything out, and, just gave me a bunch of bad news. And I answered the phone because, I knew the number, 222-1111. So I answered it because that's the doctor. So when they called, I answered it, stepped away from the table, talked to him for a little bit, got really emotional, gathered myself, sat down at the table, and just told Honey, we'll talk later, everything's all right. It was 2 weeks of real hell waiting for Dr. Newberry, because this was, right before Christmas break that Shelby graduated from college. She graduated in December. So it went 2 weeks until January for Dr. Newberry to come on board and give me a call and say, "Hey, everything's checked out." And I'm like, "Dude, that's not what the guy in hemo-oncology said. He said you're going to have to go in and cut stuff out." And that was probably the only time I ever heard Dr. Newberry get upset. He's like, "I'm your freaking surgeon. I'm the guy that makes that call. And he's wrong." And he said, "As soon as I get off the phone, he'll be calling you back." True to his word, I don't know what Dr. Newberry did, but that guy called me up and said, "Yeah, we were wrong." I said, "We?" And he said, "I was wrong." And I never saw the guy again because I never went back. I just stayed with Dr. Newberry, and he took care of me. So like I said, we went into radiation every day, and then almost every time that we went in for radiation, I would go to that hemo place and get chemotherapy, or not chemotherapy, an IV into me. My last day of treatment was the 27th the 29th of September, which is 2 days after our anniversary. So that was a good day for the last radiation treatment. So let's get back to chemo because I skipped something. For the first 2 chemos, I actually was admitted to the hospital. That first one really gave me a wallop. It was hard on my body. I couldn't keep anything down. I just lost a lot of weight. I stayed in the hospital for like 4 days. The only good thing is I had my own room because there was a chance that I would get sick if somebody was in my room that was sick with something besides what I had. So after the second radiation, again, I got sick and they admitted me again. They were debating whether or not to give me the 3rd round of chemo. And I told them, "You know what? I need it. Give it to me." So I talked to the doctors, went through that, and Newberry was on my side, said, "Let's do this. He'll be all right. If he gets admitted, he gets admitted. It'll be okay." So luckily, the 3rd time I did not have to get admitted because I think that the fact that we finally got my food straight, I was on the kangaroo getting food that way. So it really worked out. It really worked out well. So after that 3rd round of chemo, it was great to get up there and ring the bell, saying it was my last treatment. I saw the little certificate right here in my filing cabinet saying that I graduated from chemo. And then again on the 29th of September is when I rang the radiation bell. And there in radiation, in the hallway going towards the machine, they have two radiation machines back there. In the hallway leading to mine and the hallway leading to the other machine, cancer patients would put their handprint on the wall. So I have a green hand on that wall with my signature next to it. And a year later, I went back and took the same picture, with my hand on the wall. And I gained so much weight, I couldn't really recognize myself. Because I was just deathly skinny. So some post-treatment considerations to think about. I don't really have any hard side effects. Well, that I would consider hard. I didn't lose my hair, didn't do that. I did lose some hearing. I had some additional hearing loss just because of the cisplatinum, the little cells in your ears that have the little hair follicles that make you hear. Once those are damaged, they're damaged. They don't regenerate. The nerve damage in my hands, my fingers still tingle a little bit, so do my toes, but I don't drop things anymore. I can walk fine. I can run shorter distances than I used to. My throat does have scar tissue in it. So just a couple weeks ago, I actually had surgery where they widened my throat. The first time I did it, I almost didn't wake up. That was 3 years ago. This time, everything went smooth, and I'm glad that it did, because it's with the scar tissue, when it builds up and it gets super tight and hardens. I can't eat. I had to give up chicken for a little bit. I couldn't eat steak at all. So now, yesterday we went out and had a steak, and it was just so good to sit down and be able to eat like a normal person. Almost all of my teeth are capped now. Again, the cisplatinum killed my saliva glands. So they have regenerated a little bit. I can form a little bit of saliva, not a lot. So I'm constantly drinking water and drinking while I'm eating, just to help chew up my food so I can swallow it. The thing about dental care is I had a tooth that was bad here on my right side where I had most of the radiation. I had to go in to a oxygen chamber and sit in there with 6 of my buddies for an hour as they hypersaturated my body with oxygen. So, and that was just so that my body, when I came out of it, had the surgery to fix my tooth, replace my tooth really, into my jawbone. My jawbone would regenerate quickly. And that's something I have to do for the rest of my life, just because of the damage here. I can't really open my mouth as wide as most people. I slur some words sometimes, just because of the damage to my tongue. But regaining everything that I have and being able to eat and drink is nice. And as far as anything else, I can't really think of anything besides my throat and my teeth and my hearing. That's really about it. I used to have a radiation burn right here. Kind of looked like a love bite. It's pretty much gone now. You can see it sometimes when the light's just right. Just a reminder of where my radiation was, my tumor. So some takeaways, if you're ever battling cancer, especially throat cancer, listen to your docs. A buddy of mine, Johnny, he had the same cancer I did. And for him, it wasn't as harsh on his throat as it was on mine for some reason. He got the peg, but he refused to use it. So his recovery was a little bit faster than me. He didn't lose as much weight. He lost some weight, not as much as I did. So be proactive. If they offer you the feeding tube, take it just in case, because you never know. The port was so great to have. It was easy. Just go in. They didn't have to tear up my veins. That was a good thing. And something I forgot to tell you is when they were putting the port in, the doctor had this big TV screen up because he was running the tube into the artery and then down into my heart, right above where the valve was. And when he was watching the screen, I was looking over my shoulder at him doing his work, and that was kind of cool, seeing the little tube going down and where it ended up and all that good stuff. That was pretty awesome. But anyway, back to some takeaways. Learn about the treatment that you're going through. We did our research on the cisplatin, but we really didn't think and do a lot. And looking back, that was a harsh treatment. But I'm on the right side of the grass. I'm walking on it, not underneath it. So I guess what I gave up to live was worth it. Ask the doctors all the questions that come to you. I really wasn't the question guy. Honey was a question person. She was asking everything. And she had her little notebook there. And for the caregivers who are listening, write everything down. Every little thing. How much medicine's taken, how much painkillers, how much water did they drink, how many bottles, this, that, and that, all that stuff. Write it down, because the doctor's going to ask, and if you're ready and you've got the answers, they're there. About being proactive. If you don't agree with your doctor, get a second opinion. I trusted Newberry when I met him. His boss came in, gave me a second opinion. Everything worked out with the ear, nose, and throat guys. Hemo-oncology, I got rid of the doctor I didn't like, that, in my opinion, hadn't done due diligence in checking my file out. Don't be afraid to voice your concerns. Emotional resilience. I was a joker with all of my caregivers. I've got on my right side, I've got a huge vein there. And I would tell the hemo-oncologist when they come in training, I said, you better not screw this up, Junior. I'm giving you a prime target. And 9 times out of 10 they would. And they'd have to poke me again. But I would give them I'd given them a lot of shit, actually. But one of the kids asked the doctor why I was being so mean, and then he said, he's not being mean, he's joking with you. And if you can't take that, what do you think is going to happen when somebody's really angry and yelling and screaming? So as a teacher, I knew it was important to kind of mess with the guys, but let them know that they're doing a good job. And I always thanked everybody for everything that they did, because, again, they saved my life. Make sure that you question your doctor, talk to your doctor, work with your doctors. That emotional resilience thing, let's go back to that. Cancer sucks. It's emotional draining. It is, it's important to acknowledge your needs without asking too much of people. If you know what I mean, there's a balance there. I know I had visitors. One of my aunts came to visit, and I don't know what she was wearing, but it set me off, and I started screaming, "Get out, get out." Oh, just her perfume set me off, and I couldn't take it. I had visitors come over all the time. Thank goodness my mom came over to help Honey, because she was emotionally drained. So just remember not to be that guy, that patient that wants everybody to bend to their will. So in conclusion, I've often said that honey saved my life. And she has. She did. Without her, I wouldn't be here. I've been in combat. I've been in a lot of close calls, been in a very hard landing in a helicopter. And I walked away from all that stuff. But I really don't remember being afraid that I wasn't going to make it. With cancer, I was. When I was in the hospital, I remember there was a point where I did not want to go on. And when I let that be known to Honey, she kind of encouraged me out a little bit, told me not to give up and to quit being a wuss, basically, using some other words. But she pulled me through this, and I love her with all my heart. So I also have to acknowledge another person that helped me through, besides my mom and my kiddos and all that. My job, John Cooper, who helped me out so much as my boss. But my cancer buddy, my boy Max, he was a white boxer, 85 pounds of I don't know what he was. He was just joy. He had some goofy eyes, some messed up teeth, but he was my boy. And I call him my cancer buddy because he got cancer. When I was going through my cancer, he knew when I was sick. He would come and rest his head on my knee because he couldn't get his fat butt up onto the sofa. And he would just comfort me. When my kangaroo would beat to say that it was empty or something was wrong, he would start barking to alert Honey. But he was always by my side. His bed was right next to me. And the only time he'd leave is when Honey pour food into his dish because he's kind of a food hog. He'd get up, run over there, eat, go to the bathroom, come right back in and lay down next to me. So when he got cancer, they said that removing the cancer wouldn't guarantee that he would live, that long. Honey said, well, what do you want to do? And I said, there's no way I'm putting Max down. We're going to do everything we can to save that damn dog's life. And we did. And he stayed with us for a little over a year, additional time. I kind of felt that I owed him that. I miss that damn dog a little bit. So, back to today's essential question. Why is it important to plan for emergencies or end-of-life situations while you're clear of mind? I'll tell you, if you don't do it now, while you're clear of mind, you might not get a chance to do it. So, like we always say, plan now while you're clear of mind, and everything will work out. Have a great night.
And just like the vibrant hues of a setting sun, we're wrapping up another episode of Thoughtful Planning. Every shared story and insight is a step closer to turning uncertainty into celebrations of preparedness.
Absolutely. And to our listeners, remember that every surprise that comes our way is an opportunity to grow, adapt, and learn. Stay tuned for more stories, expert insight, and of course, a touch of wit in our next episode.
We're not just co-hosts, we're fellow travelers on this journey. For more information on additional resources, which will help you take the next step in planning, look for the link in the show notes for our membership. Join us next time for another episode of Thoughtful Planning. Until then, keep living, laughing, and loving every moment.